Did you know that not all nose jobs turn out perfect? Many people experience redness, implant shifting, or even worse, nasal infections. Some cases are minor, but others can completely ruin the shape of the nose. So, why do these complications happen? More importantly, how can you prevent them? Let's break it down. Common rhinoplasty complications. Number 1. Nasal tip redness, skin thinning over implant. One of the most common complications is redness on the nasal tip. This usually happens when the skin is too thin, or when an implant is placed too high, creating excessive pressure. Over time, the skin loses blood circulation, leading to irritation and possible implant exposure. Number 2. Implant visibility and transparency. When an implant is too large or not properly positioned, it may become visible under the skin, making the nose look artificial. This is especially common in patients with thin skin or poorly chosen implants. Number 3. Nasal deviation and asymmetry. If the implant is not securely fixed, or if post-surgical healing is uneven, the nose may become crooked or asymmetrical. In some cases, trauma or excessive movement after surgery can worsen the issue. Number 4. Infection and nasal necrosis. The most dangerous complication is infection, which can lead to tissue necrosis if untreated. Warning signs include severe pain, foul-smelling discharge, persistent swelling, and skin turning dark purple or black. How to fix these complications? Number 1. Fixing nasal tip redness and implant visibility. The best solution is to replace the implant with a smaller one, or cover it with autologous tissue like temporal fascia to prevent thinning. In some cases, using diced cartilage with fascia can also help smooth the contour. Number 2. Fixing a crooked nose, implant misalignment. For minor asymmetry, filler injections can be used to correct small deviations. However, if the implant has significantly shifted, revision surgery is necessary to remove and reposition it securely. Number 3. Treating infection and necrosis. Mild infections can be treated with antibiotics, but if necrosis occurs, the implant must be removed immediately to prevent further damage. Early detection is key to avoiding serious complications. Biggest mistakes that cause complications. Number 1. Choosing the wrong surgeon. One of the biggest mistakes is choosing a surgeon based on price rather than experience. Always check their portfolio, read patient reviews, and consult multiple doctors before deciding. Number 2. Ignoring post-surgery instructions. Many complications happen simply because patients don't follow proper post-op care. Touching or pressing the nose too soon, engaging in heavy physical activity, or consuming alcohol can lead to swelling, infection, or implant misalignment. Follow your doctor's guidelines strictly. Number 3. Choosing the wrong implant type. If you have very thin skin, avoid using large synthetic implants. Instead, opt for autologous cartilage to reduce the risk of complications. The right implant choice makes a huge difference in the long-term success of your rhinoplasties. How long does nasal tip redness last after surgery? Mild redness can last a few weeks as the skin heals. However, if redness persists for months, it could be due to implant pressure or poor circulation. In that case, you should consult your surgeon immediately. Can I fix an implant that has become visible without surgery? If the implant is only slightly visible, certain dermal fillers can help mask the transparency. However, if the implant is too close to the skin, revision surgery is the best solution. Why does my nose look asymmetrical after rhinoplasty? Mild asymmetry in the first few months is normal, as swelling reduces unevenly. However, if the deviation is severe or persists beyond 6 months, It could be a result of implant shifting or incorrect surgical placement. How do I know if I have an infection after rhinoplasty? Signs of infection include persistent swelling, extreme pain, redness spreading beyond the nose, and foul-smelling discharge. If you notice these symptoms, contact your doctor immediately. Have you experienced any concerns after rhinoplasty? Leave your questions in the comments, and we'll cover them in the next video. And don't forget to like, share, and subscribe for more expert insights on plastic surgery.